What now is the signs of labor? Now, most things that people call signs of labor might not really be signs of labor. Now, before we can come to the conclusion that this person have seen the signs of labor, the first thing is, when is the due date? Can you remember the right date? And now, the right date is gotten from so many places. If the woman in question is very sure of her last menstrual period, we can use the last menstrual period to calculate her expected day of the delivery. That is, if she is sure. And when we talk about this last menstrual period, we are concerned about the date the menses actually started, not the day it ended though, not even when she is supposed to see her next menses. Now, but there is another way around it. If we are able to do an early ultrasound, I mean an ultrasound we do before 5 months, 20 weeks, that ultrasound, once it is done in the right hand, we will be able to know that this is your expected day of delivery. So some women will come and say, we did our first scan, he gave us 10th. This one we did again is giving us 18th. We do another one, is giving us 20. Which one are we going to take? The first one is the one we are taking for the date. Then the last one is the one we are taking for the position. So by the time you do a scan at early stage, maybe 4 months, the baby might be sitting down. Sometimes you see some women without bordering. This child is sitting down. It's not staying well. But the position of the baby at that time is irrelevant. Allow the baby will assume transverse, will assume bridge, it will assume cephalic, but after 36, 37 weeks, usually the baby will now assume the final position. So people can say, you don't need to do anything. Nature has taken care of itself. And the baby will go from bridge, and eventually while you might dislodge the placenta, you might actually find a way of giving the child more complication than even the position of baby. So we don't usually try to do that. Initially it was done, and it was called external cephalic version, but it has been discouraged. Nobody does that again now, because the baby will eventually turn if it want to turn. If the baby didn't want to turn, no matter what you child not to that position. I don't know if you understand. So before we will say this person has seen her whole signs of labor and nothing happened, we must be sure that when are we really dealing about the expected day of delivery. Then the next question is, are you sure this person is having real labor?